I'm Erica Hollis. I live in Columbia. I was born here in Columbia. When things first started for me, like my epilepsy, I knew I didn't feel right. I woke up in the middle of the night about 3 a.m. and I was like, oh, something's not right. And I immediately passed out and hit the bathroom door, hit the wall on the other side, and it looked like I got beat. Nobody believed me until I was diagnosed with epilepsy, until I had the second one, from what I remember, in the ER. And that's when they started giving me all the medicine, and I just did not feel like myself. I was having them left and right, having them at work.
So Erica Hollis had temporal lobe epilepsy. Hers was specifically from the left temporal lobe, and it's what we call a focal epilepsy, meaning it's coming from one area of the brain. So epilepsy is a abnormal electrical discharge in the neurons of the brain. It's clinically defined as 2 or more seizures that haven't been provoked by some outside factor. She was not responding well to medication. She had tried many medications before. And because her seizures came from one area, she was a surgical candidate.
She then underwent a pretty rigorous stay at our epilepsy monitoring unit, where they stay over a number of days without any epilepsy medications. We record her brain waves and actually videotape her throughout her stay and count the amount of seizures she has and record from what parts of the brain the seizures come from. She was presented at our epilepsy meeting, and that's where she was brought to my attention.
Dr. Mangubat and Dr. Peters, I saw them both kind of around the same time, and they're the ones who immediately started, let's do this, let's do that, let's do this, let's do that. It just all worked out. They knew, they came up with a plan. All of a sudden, they started giving me answers that I never had answers before.
There were a couple of options for Ms. Hollis. One was an open procedure through a craniotomy, which is actually a more classic way to treat mesiotemporal sclerosis, where we remove part of the temporal lobe and also remove the hippocampus and the amygdala, where the seizures are coming from. The procedure that we all came to the conclusion to offer Erica was something called an MRI-guided laser ablation of that portion of the brain. Essentially what that involves is, through a very small burr hole in the back of the skull, we're able to use image guidance to place a cannula with a laser into the hippocampus and the amygdala, which is causing these seizures. And then the patient is still asleep, is brought to the MRI suite. We take advantage of something called thermometry. We're able to raise the temperature around the laser to a point where it can injure the brain. But with the thermometry portion of the MRI, we're actually able to watch where the temperature is being delivered and how much temperature. We're able to actually ablate or cause injury to the parts of the brain that are causing seizures while keeping the rest of the brain safe.
So since her procedure, she's been doing very well, because she was having seizures almost on a daily basis before that.
I'm making the best of my situation, I really am, because I am so thankful. They're the best doctors I've had. Dr. Mangubat and Dr. Peters, they have treated me so well. They made me feel so comfortable with everything. They listened to anything and everything I had to say.